I'm Sally Johnson. I had a total hip replacement surgery at Spire Hospital, Little Aston. So following surgery, I wanted to get back to being able to ride my horses without the pain, without having to take so many painkillers to make it bearable.
Hi, my name's Mike Harris. I came to the Spire Hospital at Little Aston to have a right knee total replacement via the Mako system. The reason I came to the Spire Hospital was basically when I met Mr. Jane, he mentioned the Mako system, and I said I was very interested in it, and we had a little chat about it. And I said, I think I'll go for that, but I'll just check it out for myself. So I went online, looked up the videos, very impressed. So 2 days later, his secretary phoned me and I booked up for the operation.
I'm Shiv Jain. I'm consultant orthopedic surgeon at Spire Little Aston Hospital. I've been practicing as a consultant for the past 8 years. My special interest is joint replacement surgery, and I specialize in Mako robotic assisted surgeries as well. So the robotic arm surgery is a big leap into the next generation and is set to transform the joint replacement surgery forever. It not only allows surgeon to insert the prosthesis precisely, but also position it accurately, time and time again, so it gives consistently good outcome and it improves the patient satisfaction. In robotic arm surgery, I take a CT scan of the patient first, and then this CT scan is fed into the computer, which generates a 3D picture of the patient's own anatomy, and based on that we choose the size of the implant and positioning of the implant which is specific to that patient.
My name is Mr. Seltzer. I'm an orthopedic consultant. I've been an orthopedic consultant for 13 years. Robotic arm surgery is like a new step into a whole new world. It allows me during the operation to fine-tune adjustments which I encounter.
The days immediately following surgery, I was standing up the same day, so I had surgery late morning, and by the afternoon I was standing up, completely pain-free. So the overall recovery process has been pretty straightforward. I was driving very quickly, but the key for me was being given permission to sit back on a horse again.
Within 3 days of the operation, I was able to walk on crutches. I was able to go up and down the stairs, at which point I was discharged from the hospital. 3 weeks later, I was playing golf, tentatively at first, but 4 weeks later, I was playing my normal game. Well, when you tell somebody, oh, I'm going to have a knee replacement, all of a sudden, everybody knows somebody that's had it done and they've suffered. You know, oh, so-and-so had it done 3 years ago and they're still in pain. And when I say to them, well, I had it 4 days ago and I've got no pain, they don't, you know, they tend, oh, he's having me on, you know what I mean? But it's just a fact of life. I just have not suffered.
The key benefits to the patients having Stryker Mako robotic arm surgery is the surgery is very specific and accurate for them, which leads to precise implant sizing and positioning. This in turn leads to less post-operative pain, faster recovery. Patients may be able to go home sooner, and eventually they will have a higher satisfaction rate post-operatively. And in the long term, the implant may be able to last longer for the patient.
Benefits of the Stryker Mako robotic arm assisted surgery for me as a surgeon are that I can provide better precision to my patients, that they make a faster recovery and have much better longevity of the implants and their joint replacements.
The whole experience with Spire was fantastic. I can't fault the speed of having been seen through to the point of having surgery. The care whilst I was an inpatient was fantastic, and the follow-up has been, you know, faultless, to be honest.
To anybody who's considering using the Mako system, my honest opinion is don't hesitate. Get in there, get it done and recover, and you will not regret one moment of it.